Hey guys, so I had somebody request this specific topic and I thought that it was definitely interesting. And the topic is the differences between the job duties of a CNA versus a medical assistant. So I wanted to address this because obviously I am a medical assistant, but I'm also a CNA. I've worked for 5 years as a CNA, and in February of 2021, became a certified clinical medical assistant. Um, so let's talk about this. So, medical assistants do a mixture of clinical, which is patient care, and administrative tasks. So, a medical assistant could work the front desk or the back office, depending on what type of job they have. So, on the patient care side, the job duties of a medical assistant would include vital signs. Medical assistants administer shots and medication. They prepare blood samples so we can draw blood. We can process those blood samples for different lab testing. We also prepare the exam rooms, and we can assist the provider during the patient exams. On the front office or administrative side, MAs schedule appointments, keep records up to date. Um, during the visit, we enter information into the charts as far as documentation. We take medical histories. There are some medical assistants that do billing and coding. You can do medication refills over the phone or online. You can do prior authorizations. It all just depends on the specific job that you are hired for as a medical assistant, what those specific duties would be. Now, when you look at the difference, a CNA doesn't really do administrative tasks unless your facility has you doing administrative tasks. Most CNAs are just only doing direct patient care. Um, you're doing that basic patient care tasks as far as like helping them get dressed, helping them take a bath or a shower, feeding them, setting up their meal trays, transferring from the bed to the wheelchair, from the wheelchair to a shower chair, um, stuff like that. CNAs can also take vital signs, and it depends. Some facilities want the nurses to do vital signs, other facilities will have CNAs do vital signs, and obviously, then the CNA would communicate any concerns or needs of the patient to the nurse. So, CNAs work directly under nurses, and most of the time, medical assistants, um, if there's no RN or nurse in the office, would report directly to the provider, which would be the mid level provider, such as a nurse practitioner or a physician assistant, or they will report directly to the physician. So then, when you think about the work environments that a medical assistant or a CNA would work in, medical assistants are most likely to be found in a clinic setting. 57% of medical assistants work in doctor's offices, according to the Bureau of Labor Statistics. I did do my research for this one. Only about 15% of medical assistants work in hospitals, and the remainder can be found in outpatient care facilities or chiropractor offices. And because of this, most medical assistants don't work overnight hours or during the holidays, because most doctors' offices or outpatient clinics and chiropractors' offices are not open on, in the middle of the night or on a holiday. So, as far as that, a CNA, obviously, a lot of CNAs work in long term care facilities. According to the Bureau of Labor Statistics, most CNAs work in nursing care facilities, which is 40% of CNAs, or assisted living facilities, which is 11%. CNAs are also more likely to work in hospitals than medical assistants, because a lot of hospitals are using LPNs or RNs to work in hospitals, not medical assistants. A smaller percentage of CNAs work in home health care, and obviously, with a CNA doing so much basic like ADL care, CNAs are needed 24/7, 365. So, a CNA is much more likely than a medical assistant to have an overnight schedule, have to work on the weekend, and have to work holiday shifts, as all my CNAs know very well. So, um, if you want to get a job as a medical assistant or a CNA, these would be the top skills that the Bureau of Labor Statistics says that each of these need. The top skills for medical assistants would be appointment scheduling, measuring vital signs, CPR, injections, and the ability to perform an EKG. Top skills for CNAs, according to the Bureau of Labor Statistics, is ADL assistance, which is activities of daily living, bathing and grooming, also measuring vital signs, and home health assistance. So the Bureau of Labor Statistics also says that medical assistants can benefit from being detail oriented and having analytical skills that will assist them in maintaining the patient's chart and other administrative duties. And CNAs do well with strong communication skills and physical stamina that is required to adequately care for their patients. So, if we look at job outlook and salary, medical assistants can expect job opportunities to grow much faster than the national average. The BLS, which is Bureau of Labor Statistics, predicts employment for this healthcare job to grow by 29% from 2016 to 2026, which is more than 4 times the national average. And the median annual wage for a medical assistant is $32,480. CNAs also have a faster than average job growth, which is 11% compared to medical assistants' 29%. And the median annual wage for CNAs was $27,520 in 2017, with those in hospitals earning about $2,000 more than that per year, and those working in the government bringing in about the same, maybe even a little bit more than a medical assistant. So obviously, with medical assistant and CNA, there are also different education requirements. You don't, particularly or necessarily need a degree, but you do need training. There are jobs that will hire medical assistants who have not gone through any training, and they will train you on the job, but most employers in the United States require someone to at least have gone through a training program. So, obviously with a CNA, you have to be certified, which is through your state. You have to go through a state approved program, and then you have to pass your exams to become a certified nursing assistant. So I hope that this was helpful for those of you who were interested in finding out like the differences between medical assistants and CNAs. If you'd like me to take a deeper dive into it and talk more about like different tasks that a medical assistant or a CNA can do, I can definitely do that. I do plan on filming more medical content as we go through time, I guess, because I do want to share my knowledge and what I've learned with you guys, and I want to help you guys as much as possible. So if there's something that you want to learn in regards to phlebotomy, CNA, medical assistant, nursing school, healthcare in general, please let me know, because I would love to create helpful content that you guys actually get something out of. So, with that being said, that is all I have for today. Leave any topics or suggestions or comments in the comment section below. I would be so glad to hear from you guys, and I will talk to you guys in my next video.